Hey, how's it going today? I'm Dr. Coleman, going to be taking care of you today. First and foremost, thanks for choosing us to take care of your needs. Hopefully we can get you out of pain and get you taken care of today and get that tooth out. First thing we're going to do is we're going to numb that tooth up very well. We're going to get that tooth out for you. I'm here just to explain a few post-operative instructions that we can go over that's going to help you heal up very nicely after we get that tooth taken care of. Once we take that tooth out, you can expect to experience some pain. There will be some pain for 7 to 10 days. Hopefully we can help you with that and manage that pain and make it to where it's not so bad, but there are some things you can do following the extraction that are going to make that very easy for you and to help not have more pain than you need. First and foremost, once we take that tooth out, we are going to want a blood clot to form in that extraction site. We want that blood clot to stay in there, much like a cut on the arm that's bleeding. We want to apply pressure on there. Once we get that tooth out, we're going to apply pressure on there to get that blood clot to form. We're going to do that with some gauze. We're going to send you home with some gauze that we are going to have. We want you to fold that gauze up. We want you to bite on that gauze and keep good pressure on that for about 30 minutes. After about 30 minutes, you can take that gauze out and replace it with a new dry gauze. Once you have been through that gauze and there's no more bleeding on there, you're okay to leave that gauze out for the time being. Once that blood clot is good and formed in there with that gauze, there are some things that you can do that can disrupt that blood clot that we want to prevent you from. First and foremost is going to be smoking. If you're a smoker, we ask that you don't smoke for 5 days following the extraction. When you smoke, you create suction. That suction can pull that blood clot out and it creates what's called a dry socket. That is more painful than a toothache. So no smoking for 5 days after the extraction comes out. Another thing that you can do to pull that blood clot out is suck through a straw or drink through a straw. When you drink through that, you create a vacuum that can pull that blood clot out. Once again, that can lead to a dry socket. We want to prevent those things. We do want you to rinse using some warm salt water. Quarter teaspoon of salt and some warm water can help you rinse, but we don't want you to do that for 24 hours. So 24 hours from now, you can rinse, and that will help the gums around that heal. If you rinse before the 24 hours and swish real vigorously and spit real forcefully, once again you can pull that blood clot out, creating a dry socket. Certain foods to avoid. We want you to avoid carbonated drinks. We want you to avoid any sharp food that can get stuck down in that site. If there is food that gets stuck in that site, we don't want you cleaning it out. If you go and try to clean that out, you can pull that blood clot out and create a dry socket. Some of these things are things that you can do that can help your post-extraction go very smoothly. We hope that this is a great experience for you, and we thank you for choosing us. Once again, here are some instructions for post-operative care after your extraction. Number 1, no smoking or drinking through a straw for 5 days. The suction can remove that blood clot and create a dry socket. Number 2, bleeding. Please remove the gauze from the extraction site 30 minutes after you leave our office. If the area is still bleeding, place new gauze in the extraction site and change every 20 to 30 minutes until the bleeding stops. Number 3, do not rinse your mouth today. Tomorrow you can rinse gently every 3 to 4 hours with warm salt water. That's a quarter teaspoon of salt and 1 cup of warm water. Number 4, food to stay away from. We advise staying on the soft diet for the first 24 hours following an extraction. After 24 hours, you can eat what you feel comfortable eating while staying away from small foods like rice or potato chips. Very important, do not flush the extraction site with water. You will risk flushing out the blood clot, causing a dry socket. Number 5, pain. You can expect to experience pain for up to 7 to 10 days following extraction. If you have any unusual symptoms, please contact our office. Other things to avoid for 7 days: water pick, mouthwash containing alcohol, and carbonated beverages.